have your MAR, which is your orders to tell you what to do. You're going to first wash your hands, always the most important step. And no matter what you do in the medical field, wash your hands. So, first thing I'm going to do is I'm going to make sure I have the right patient. This one says it's Baby Charles. So, Baby Charles, and it's for 11 a.m. The time's 11 a.m., so I'm looking at the right medication. Now I'm going to go through and I'm going to look at what he needs. He needs a hepatitis B vaccine for today at the 11 a.m. It's calling for 0.5 mLs, which is within normal prescription limits that I would expect to see. He wants an IM route, so when I go get the medication, I want to look for the right IM. And it tells me the location of the vaccines. It just says that my patient only has an allergy to ink betadine, but I'm willing to verify that when I go to the room and double check. So, based on this, I'm going to find the med I need. So I'm going to unlock my med cart. I'm going to open it up. I'm going to find the medication that I'm looking for. So this says Hep B. So I'm going to look again. So hepatitis B vaccine. This is an IM solution. So I have the right route for the medication. This says that it has 0.5 mLs. So I have enough to draw up from this. And the expiration is intact. So you want to make sure you have the right expiration, otherwise you have to get a new vial. So with that being said, I'm going to take it out. I'm going to close my drawer. So now I'm going to do my second check where I double check the medication again. So you do it before you pull it out and once you have it out. So you go through it again. Right patient, Baby Charles, born today. 11 a.m. is when he needs a shot. You want to go through and make sure that you have right drug, right dose, right route, right reason. This is a vaccine, so the reason is to help protect them. You also want to make sure that you have the right time, which we did that. So now I'm going to show you how to draw it up. So first things first, you want to find the right syringe. So we need 0.5 mLs. So a 3 ml syringe is going to be really large. So the best one I have on hand right now is a 1 ml syringe. This one is already set up for me, so I know it's the one I need to use. So I'm going to now use an alcohol swab. And we're just going to clean the top of the vial, if I can get it out of the package. Clean the top of the vial. You want to make sure that it's sterile and clean. Germs, dust, you don't want that on your syringe when you go to give an injection. So, I'm now going to open up the syringe. I'm going to take the cap off. I pull the shield up, my own personal preference. You don't pull all the way to the lock. I need to draw back air with the plunger to how much I need. So I need 0.5 mLs, so I'm going to pull back 0.5 mLs. Should I get it there? There you go. So, I have the right air. I'm going to pull the safety back. I'm going to put it into the vial, face down. I'm going to push the plunger in to inject the air into the vial. Now, you're going to hold the plunger because it can come back up, the air. And some medications you can't push it back in. So I'm then going to flip it. And I'm going to pull down. I'm going to try not to get any air bubbles. I'm going to pull down to 0.5 mLs that I need for this vaccine. Alright. Alright. I did really pretty good. There's no air bubbles, so we're good. So my safety shield's up. I have my medication drawn. I'm going to grab my supplies that I need, which is one alcohol swab, cotton pad to press on after the injection, and tape. If you have multiple injections, some people have, they label the syringes so they know what's the medication within the syringe. This one I'm handling directly, it's not going to go to my site, and I have my MAR. so I feel comfortable having it the way it is, and I'm going to use the tape for the cotton swab if my patient would like to keep that on. So I'm going to have to put away my vial, but I want to just double check one last time that everything's correct. So I'm going to make sure I drew up the right amount, which is 0.5 ml. 0.5 ml is the right route. This is an IM medication. For the patient, baby Charles, for 11 a.m., which is the time, and then the date of birth, which is today's date, and then the hepatitis vaccine for the reason for getting vaccinated. So I'm going to put the medication away, and now I'm going to grab my supplies. Okay, so now I'm at my patient's room. I'm going to knock on the door. I'm going to enter. I'm going to keep my medication in front of me. Once you draw it up, you can't take your eyes off of it. I'm doing so to look at the camera, but so I'm going to quickly just wash my hands. I'm going to introduce myself with a baby. You can introduce yourself to the baby, but you also want to make sure that you acknowledge the parents. They are also part of the patient care process. So, hi, my name is Melissa. I'm your student nurse today. I'm here to give baby Charles his hepatitis B vaccine. Are you aware of this? Yes. You want to make sure that parents sign a parental consent form. You can then ask the parents for the verification information for the baby, or you can check the baby's bracelet, or both, depending on the procedures that you follow for your facility. You also want to double check with the parents if you have any allergies, anything I should know beforehand. Benadine, which does not interfere with this vaccine, so we're okay. You want to then tell the parents, I'm here to give you your baby 0.5 ml of the IM injection on the vatus luteus, which is the muscle on the side of the leg, because most parents probably won't know the Latin phrase. So double check all that, and then you want to provide the privacy. We have a single room, so it works out okay. So I'm going to take my MIR, and then I double checked everything with the baby. Keeping my medication in front of me. I don't want to put it in the baby's crib because I don't want him to hurt himself with the needle, so I want to keep it right next to me where I can see it. The baby's in a safe environment. The crib is okay and stable. He's not going to fall out or wiggle out. I'm going to put on some gloves. And when I identify my patient, I'm also going to make sure that I have the right med dose route, the time, which is 11 a.m., the vaccine, which is what I went over with the parents. Okay. So some facilities have different legs that they do the shots in based on what the baby's prescribed. Vitamin K and hepatitis B don't want the same leg. So for today, I'm going to give the injection on the baby's right lateralis, vastus lateralis. So I'm going to show you how to mark it out. I'm not going to really inject the actual baby because it's a mannequin, so we're going to use a fake one. But to map out the landmarks, you're going to find the knee in the top of the hip here for the thigh muscle. You're going to put your palm down and you want to firmly hold the leg because the baby's going to be really squiggly and wormy. So you want to make sure you hold it well, and then you take your fingers and you want to spread the muscle. So it'll be just like this. Now, you want to usually use your dominant hand for the needle. If you can do it the other way, you can do that, but it usually works better if you have your dominant hand. So, when you map out the location, you also want to do between the knee and there, you want to split it into 3 compartments in your mind. You want to do the middle one, so like about a finger breadth above the knee and below the top of the hip. So, I'm going to take the alcohol swab, and you're going to just clean the area that you're going to do it in, and then you throw it away in the trash bin. Now I still have the safety on. I'm not going to actually inject the baby. This is a little bit harder, so we're going to try this out. So you're going to pull the safety back. Okay. You're going to make sure you have your spot all set up. You're going to hold it like a dart. You're going to go in at a 90-degree angle, nice and firm. 1, 2, 3. And this is a vaccine, so you're not going to aspirate, but you're going to push down the needle nice and slow. If you go too fast, it can cause more pain and discomfort. So once it's down, you're going to pull the needle up and out. And when you do so, you're going to turn the needle away from everyone. And you close the safety. Make sure it clicks on lock so you're putting a sharp spin. You're going to apply pressure to the injection site, but you're not going to massage it. It causes more problems in the long run. So once you feel like the baby's all set, you can remove the pressure. Sometimes babies might be more comfortable, or your preference to put a Band-Aid on or leave the cotton pad on. The baby's going to be crying. It's going to be squirming. It's not going to be happy. You can have the parents come over and soothe it and comfort it. You also want to explain to the parents after the shot that what they expect to see. There's going to be pain in the site, redness a little bit. You want to explain to them any adverse reactions before they can tell you. This is a vaccine. It has a 3 series, so you want to tell them to make their follow-up appointment in the right adequate time, which is about 4 weeks for the next shot. Then you want to clean up everything. Thank the parents for letting you come in. You're gonna wash your hands before you leave the room. You're gonna go document what you just did for your procedure. You're going to make sure to pay special attention with hepatitis B or any vaccine that you do the lot number, the expiration date, and the manufacturer. These are important, critical things to keep a record of. So you're going to take your MIR with you as well. You're going to go out the document, and then about 30 minutes later, you're going to come back, check on the patient, and make sure that there's no concerns or issues or questions that they might have.